That will be Meena Swaminathan from Chennai on leveraging social media to educate.
Thank you, Carl, for making me a part of this symposium. And Dr. Prashant Garg was just worried about bringing technology into the classroom because then they will go to social media. And here I am going to say, please use social media to teach. Okay, let's see how to go about that. So the goals are explore how social media can be utilized for resident education. The objectives are quickly trace the history of use of social media in resident education, list in what ways the social media can help residents and ophthalmic teachers, list what social media is available at our disposal, and share examples of how to use social media for different aspects, and of course enumerate the perils of using social media. So assumption is the current generation of residents are always on the phone using social media, and that's and it's a very correct assumption. Okay, so when we look at tracing the history of adoption of social media, so we're looking at pre-2010, and there was a lot of skepticism and paranoia at that time. The concerns really were about privacy, professionalism in the use, and potential for misinformation. Then came around that time the emergence of FOAM, which is free open access medical education, and that QR code will take you to the entire article. And this FOAM went through several waves, and I don't have time to go through that, but then the first wave were the founders, then there were the enthusiasts, and then the structuralists, and then the participants. So following that, the early use and adoption was primarily to provide access to resources, especially in resource-strapped areas, countries, facilitate discussions. Social media was used also to foster a sense of community. Then from 2010 onwards to now is the growth and integration phase of social media in education. Increased use by residents for personal and professional growth, for not only medical education but also for networking. We find now that there is formal integration into the curricula, not universal, but it is happening. Also, there is increasing development of online resources, which I'm sure you're all aware of, and a global collaboration and mentorship with so many organizations like Orbis addressing health disparities. Now, I did do a literature review, but I just looked at these two articles. One is looking at, the first one looked at the applicants actually checking out the social media pages of the residency programs before applying them, and how that had an impact on their selection of programs or choice of programs. And the second article talks about, it's a review article which talks about social media use in ophthalmology and use in professional sphere, and both are excellent articles. Now, but this is a really, really wonderful and comprehensive article, and you know what, I'm very lucky. Many of the things I'm going to share with you today, the authors are actually present in the audience, so any questions can be deflected to them. And this is one such, where the chief author, Helena Felipe, is right here with us. And so this is a wonderful paper that was featured in the Annals of Eye Science, which is making the case for the evolving role of social media in health professions education, and a literature review. So let's look really at how does social media integration or leveraging help the residents and educators. Really very simply on four areas. One is, of course, for education, promotion and marketing, networking, and branding. So these two tables, the next two tables that you will see, I've actually taken from that article, and this talks about the critical factors for embedding social media in health professions education. So we look at the first factor, which is design of the learning experience. So even if it is social media, you have to make sure that its incorporation in the curriculum, that you've ensured that whether you have decided whether it is synchronous, asynchronous, hybrid, or blended, And also make sure that it's a well-designed learning environment that enables participants to develop meaningful dialogue and share educational resources. Those are the kinds that you as an educator is going to introduce and support. Now, what is your role as an educator? The educator should act as a facilitator. You have to curate the content. I mean, there's a lot of nonsense out there as well. And not only that, you can also use that and enhance and have a topic or a discussion. So you're an amplifier. Most importantly, you're a role model. So if you have your own Instagram account and you are discussing patients and cases and surgeries, make sure that these are done in a very professional manner, keeping all the professional etiquettes in mind, and the social media etiquettes in mind. You're also mentors, and you're guiding the learners and catalyzing the learning journey. All this is very important when you are introducing social media to your residents or supporting them. Also, the selection of social media platforms. This selection impacts the depth of the educational experience, and we are going to talk about that, look at the slides of examples of what do we have there. And the purpose of the learning experience has to be very clearly set out before even embarking on incorporation of social media, that it aids in the formation of professional identity to receive, exchange, seek, create, store, and organize content. So what do we have out there? So if you look at the Web 2.0 tools, you have Facebook, Google+, X, which are examples for social networking. For professional networking, you have Instagram, YouTube, LinkedIn, Vimeo, and microblogging. And knowledge aggregation, you have wikis, forum, and gaming environments, which is again a whole topic in itself as gaming-based environment or gaming-based learning, GBL, as an important tool in medical education is another topic in itself. So I wanted to introduce some examples from our Indian subcontinent. So this she's actually a friend of mine. She runs something called iMentor, and this is her YouTube with 41,000 subscribers, and Instagram is 25,000 followers. And she basically coaches for the NEET exam. But her content is very good for medical students and for new residents as well. Now, if you look at other examples, this one is a very popular quiz on Telegram, ophthalmology MCQ quizzes on Telegram, which is like running 24/7. This, on the other side, is you can see 65,000 subscribers with 2,500 videos of cataract surgery. This happens to be my junior during my residency. He's very popular. He uploads very interesting and very different, vastly different cases of cataract surgery. Now, this, again, as I said, we have our own author here, Pranesh Balasubramaniam, who's King's Crux. Look at what the topic says. This is a short 6-minute stage talk on effective use of social media to deliver quality lectures. That is one of his talks. He's a really, really wonderful teacher, and this is something you can incorporate in your curriculum, introduce your residents to without reservation. And now, I have, this is called Thursdays with Dr. MS, because I go to this particular hospital on Thursdays. And so I have an ongoing quiz, so I post the quiz on it. The answers are, of course, sent to me anonymously by email. And then I post the answers with clarifications on the WhatsApp group as well. So WhatsApps can be used very effectively. And if you look at this, let me see if I can get this going. So this is actually our pediatric ophthalmology network in India. We have so all the time we have patients being posted on it, and there's extensive discussions going on. It is an excellent learning for the young professional. We have currently, if you look, I think we have 606 members. Right. I think I have to, yeah, there you go, 606 members. And so we usually, I have residents who are rotating through pediatric ophthalmology to, to make them a temporary member in this group so that they follow some of the discussions. So because it's something they can do in their own space and time. So we also have global examples in the form of podcasts. There's several micro-blogging sites, and I'm sure you're all familiar with it. And the Twitter accounts. These are very popular Twitter accounts, each one with their own flavor. But the perils need to be remembered. The disseminated information may be inaccurate. Program policies regarding use of social media is needed to guide responsible usage. The regulatory bodies and healthcare professional organizations could collaborate with training programs to establish guidelines, implement measures, and monitor. Is there really an improvement in trainees' performance and patients' literacy with the introduction of social media? This is something that needs to be measured because this is something still very new. So in conclusion, social media can be an excellent tool for resident education. There needs to be department policies and guidelines in place for their use. Judicious use and mentorship are of utmost importance. Thank you.
Are there any questions for Meena? Comments? No?
How many of you here do use social media right now for your resident teaching? Oh, okay. Thank you.
Okay. Use the microphone.
So game-based learning, not really that much for ophthalmology, but there are other specialties in medicine where through playing a game, their knowledge transfer happens. So if you go and look at GBL, you'll find that there are so many examples in critical care, pediatrics, lots in general surgery. So I guess these games have been developed. I think a lot of them also were developed around the COVID time. So to ensure that while they're all doing games, they're also learning. They're playing games. So.
Pranesh
A
is,
classroom teaching program.
do you have a talk on games? Saturday.
Do you
so
want
there's a talk on.
Do you want to make a comment on GBL?
Use the microphone because they're, yeah.
In its simplest form, just a simple quizzing is going to be a game. And indigenous flip class using Kahoot is also a game. To make it more interesting, we have got these popular game shows, and if you can adapt that into off-style teaching, that's going to be a gamification. Yeah. So nothing groundbreaking, but just that the existing game shows and popular media platforms, you can use it in our off-style education as well. Yeah.
So we have a game show in the United States called Jeopardy!
Yeah.
And I have a Neuro Jeopardy! Game show that we play at the end of every year. Right. It takes a number of adult learning principles, and doctors are very competitive. And so we have, it's called three-way Neuro Jeopardy! Because we have teams, and the teams might not seem fair, but there's the second-year residents against the third-year residents against the fourth-year residents. But each question, if you take pupils for 100, we'll have 3 different questions that I decide how tough they are. And so the second-year residents get their question, then they talk. And while they're talking, I show the third year, the next year question, and they talk, and then next. And then we go back. Okay, let's get the answer from the first-year team, and then I keep score. And after 2 or 3 or 4 sessions, there is a Neuro Jeopardy! Winner. And they get a plaque at graduation as the winning team. That's, a very cheap plaque. But they want the plaque. And they'll come back and quote me 1930s German literature about my answer not being right or their answer being right. And so they get very, very competitive with it.
If I can give you a non-medical example. So my daughter was studying in Ashoka University. And so she was tasked with making a game for Mahabharata. And then she came and asked me what for ideas. And we did a Mahabharata Jeopardy! So they had to, the participant had to pick between whether they wanted category Arjuna, or they wanted Kauravas or Pandavas or Krishna. And then the game would go on, So it was a Mahabharata Jeopardy! So you can make ophthalmic Jeopardies, yeah. And there is a Jeopardy Maker that's available for free. The Jeopardy Maker tool available